It's 5 o'clock. I'd like to call on Health and Human Services Board to order. Roll call.
Julie Medeiros.
Present.
Lisa Lind.
Here.
Sean Anderson.
Here.
Kathy Leaf.
Present.
Dave Osnes. Greg Telejohn.
Present.
Mike Barkalow.
Present.
Deb Lindeman.
Present.
Approve of the minutes from Wednesday, July 20th, 2022. Is there a motion?
I move to approve the minutes of July 2022, too many 20s in a row, as printed.
Is there a second?
I'll second it.
Second that.
All in favor, say aye.
Aye.
Opposed? Motion carries. Public comment. I don't see very many public people. Any public comment? Okay. Business items, Health and Human Services monthly financials.
Okay, so financials were included in the packet. Just a couple of things to point out. So actually, I'm going all the way down to Children's Services on page 18. Just good news, our YCSS revenues, from this time this year to this time last year are up a couple of hundred, well, just under 200,000. That's our children's long-term support, so that's just program's been growing. The funding has been more steady for that, so we've got additional revenues there. And we expect to come in over budget with that program. And that's basically case management, so it's not purchase services. That's just the work that staff is doing that will come in. Some of our other revenues for family and children's are a little above where we were at this time last year as well. As we've talked about purchase services, the bulk of that under children's services is the out-of-home placement. But it's also our kinship placements, our children's COP, some of our children's long-term support, so purchases that we make for that program. They're where they were last year, so kind of good news, bad news. We were hoping they'd be below what they were last year at this time, but we've been staying very similar. They do have a task force and things they're doing to address that. A lot of that is kind of staffing issues and things that are outside, again, the control of the department. Let's see. So ADRC, I've touched on that a little bit, so on page 20. Our donations are similar to what they were last year. We expect them to come in over budget. The miscellaneous revenue, that's the money that we get for our meals from the family care. We have to separate out family care revenue from other donations just for some of our state reporting. We can't claim 3B dollars on that, so we have to have that separated out. As I mentioned in our ADRC meeting, the catered food is higher than it was last year. That's some of the changes that we made for those meal sites where we some of the kitchens have stopped preparing food. We're now doing catered meals. Also, a lot of the meals have increased significantly. We will see the unprepared foods. Right now, it's the same as it was last year, but we expect that to really steady off and not grow very much over the next few months. That amount has decreased. When we get to our healthcare campus, so I am on page 27. For the nursing home, revenues are very similar to where they were at this time last year, just a little $36,000 below what they were. We've had our supplemental money come in already this year. That's that next line, the $194,000. One of the areas that I noticed where we're over budget is down on page 28, the 52990, other contractual services. And that's just really a coding issue. That's the bed tax that gets paid, and it's on one line, and we had budgeted on a different line. So there's no concerns with that number. Overall, the campus or the nursing home has a positive. We have more revenues than we do expenses. One of the things that hasn't posted yet is depreciation, so, we're expecting we're going to finish the year at a positive note, but we do have some expenses that haven't posted yet. And that would be very similar for Orchard View as well. Right now, they're showing a positive balance of $194,000. Once depreciation's posted, that'll bring them back closer to zero, or, to even up anyways. Any questions for me regarding the financials?
I hear none. Thank you.
Yep, you're welcome.
Next is Health and Human Services Board orientation presentation.
Thank you, Mr. Chair. What I propose doing as we go through each division and looking at a summary of the mandated services, discretionary services, and what the funding is behind each of those, what I thought would be helpful is if, whenever we do that at a board meeting, for whatever particular division we're looking at, if we did an orientation first of that division to give an overview of what those services consist of in that division, and then go into the detail about how they're funded and what's mandated, what's discretionary, and how they're prioritized. I thought it would make more sense to do that, go division by division at each board meeting, rather than try and overwhelm you with 1,000 different programs all at once. Is that okay to do? And tonight, since this is the first time HHS is reviewing our mandated and discretionary services, I thought we would start with the administration division of HHS to try this out and see how it goes and see what questions you have, et cetera. So if that's okay with the board, then we'll move ahead and do the orientation for the administration division of HHS, and I've invited Colleen and Tammy Wilson from our records division or department to provide a little overview of what they do and how they do it, and then I'll cover on the next agenda item, cover the services in more detail. Okay, so I'll turn it over to, I think Colleen will go first, and I'll be quiet.
All right, good evening. So I am the supervisor of the office support team, so basically the front group that you meet when you come into the building. We are directly under Bob. And our mission statement as a team that we made up will interface with consumers and staff in a positive, courteous, and timely manner while assisting, directing them to resources to help meet their needs. We feel really aligns with part of the mission of the county, so it really does well. I want to note the picture is not one that I took. A sheriff's department person, I think, took it with the rainbow over our building, so I don't want to take credit for the photo, but I think it's a nice photo. So, so the office support team is this group right here. We fall right under admin, and so it's Joe Alms, Susie Cook, Claudia Early, Lisa Early, and Jan Jeske is our .2 position. So that's who we are. Often we're asked, what's a typical day at the Health and Human Services Building? This right here is a typical day at the Health and Human Services Building. We have random questions every day. We have random concerns every day. We have confusion on to whether they should be at our building or should we be in Hudson. And so it's all over the board. And then besides having consumers' questions, then we work with all of the staff. So we support them as best we can. So it's, I have one of my clients is going to stop in and needs to sign this paperwork. One of my clients is going to stop in and there's a packet back here. Can you give it to them? Then they call in and I need a room, I need a car, et cetera, et cetera. So it's kind of this fast-moving front desk area. Some days are more difficult than others. You know, we have unhappy consumers. We have very consumers that are really struggling, whether it's with mental health, whether it's with their financial situation, and so it can be a difficult spot to be in some days. So I just really am so happy with how the group works. So we are under the admin structure, and it didn't really show that finance was in that structure because they're under the Hudson finance area, but we're really connected to them a lot. So we, you know, answer incoming phone calls, monitor the front lobby, collect payments from consumers, and provide a receipt. So this one kind of shows you that we, I have here, I did some quick math, that in the first 7 months, we've answered 7,220 calls. We've met with 10,709 walk-ins. Now, walk-ins can include a provider, it can include the mail person, the UPS person, but in considering the amount of interruptions and the amount of time it takes in their day, and that we need those deliveries and that we need the mail and we need, so it's someone needs to attend to those tasks, and they are up there doing that. Phone calls are, you know, constantly all day. The first window here, I think I mentioned, is Lisa Early. She's the first line, so 6991 is our main number. She takes the first call. It will roll to the other windows, so if you've been to our building, you can see that we're right at the front. We try to meet as many needs as we can at the front desk. And so we, Lisa is very new. She just started a few weeks ago, but answers the main phone line, assists with the walk-ins and consumers, will be worked on being cross-trained in several different areas, processes the daily mail, which back to the connection with finance. So in that mail, we receive checks daily. She receipts those checks in a database and then drops them in a safe, which then it's picked up by finance, who kind of does the double check of that and then makes a deposit. So we have receipted about 2,257 entries in 7 months, whether it's cash or checks. We do receive cash payments at the windows as well for people that need to make payment on their account, or that just want to drop in, like donations or those types of things can come in, the rate be dropped off. Window 2 is Susie Bruner Cook, who officially got her name changed today. She got all of her Social Security stuff and everything, so she just got married, and now she is Susie Cook. So she's at window 2, which is the ADRC main line, and she has a little higher knowledge of everything that happens at ADRC, so if we get a call that comes in, she can help them a little bit better, has a little bit of more knowledge on the ADRC, but then she also supports those staff that are connected to ADRC with whatever it is that they might need. So that's her focus, and it's really nice to be able to do that, so that if they need some little extra attention, that she has the time and is able to do that. So that's that window. And then I skipped from window 2 to window 4. So window 3, again, back to finance connection. Window 3 is a financial person, and she sits at the front, again, to help with receipting, to help with intake process, check people in for appointments, that type of thing. So she's very connected to my group at the front, is a great asset at the front to have her there, again, to meet the needs as the consumers walk in the door, and they know exactly where to go. And there's kind of a crossover. Lots of times I came in for this thing, but I also want to pay on my account, or those types of things. So that's really nice that she is there. So window 4 is economic support window mainly, but also supports the Birth to 3 program. So economic support, again, would be your food share cards, your Badger Care, those types of things. So she is, as you all know, economic support staff are all working remotely now. So she is the person in the building that consumers can drop off paperwork that needs to be scanned into their case. She can see their case to be able to answer some questions if they have them. But one of the main things that we make sure that there's at least one person at the front at every given day that could provide an emergency food share card. So in that database, there would be a note saying the person was approved for this food share card, and that it can be implemented right there at that window with the person, and they will have their food share card that day. I would say a high percentage of the time, it's actually activated and ready for them to use that day, unless it's too late in the day. So sometimes it takes till the following day. But then again, they leave there with it, so in the following morning, they are able to go purchase some food. So that's one. But then she also supports the Birth to 3 program, so helps them with their intakes and their paperwork, mailing out things to all of their clients that they're working with. She also is cross-trained to help in with the check-in process with the finance person. So again, we try to make sure there's always somebody there at the front that can take care of what a consumer may need when they walk in the door. And then in the back, who doesn't sit at the front, we have Claudia Early, and she is the main clerical support for behavioral health, children's services, and CCS. She is also our Spanish interpreter, who does an amazing job, makes the connection between the client and our staff so much more personable. So she helps all the departments with that, from WIC to Birth to 3 to behavioral health to mental health, child protection, all of those. So we do have what's called the language line, a contract with them, so we can do the over-the-phone interpreting. But when it's a real difficult situation, so if somebody's struggling with mental health, or they're going through a child protection concern, or just struggling to have food for their child, it's just so much better to have her there. So we truly appreciate it and see it as a big asset for us. But she is able to help cover at the front if we need her. So if somebody's on PTO or calls in sick, she's cross-trained to do that. And she's also our very artsy, clever one. So she works a lot on a lot of the documents that we provide and prepare. So I keep mentioning that at the front we try to have resources available. So we have flyers for each program that we provide that are out front, so people can grab them if they want. We also have several different things that the ADRC provides. I don't know if you've ever seen them, but if you have any constituents that are really looking and needing the help, these are really amazing bits of information. And then we have just a flyer that we've made up ourselves of phone numbers that consumers often are looking for. So Grace Place, Operation Help, West Cap, Workforce Resource, those types of things when they come in and are looking for food or housing, those types of things. We provide them with this and say, unfortunately, I can't find you something, but you can make some phone calls. We do offer them a phone in our lobby that they can use that. We also have computers and phones that they can do their Badger Care sign up. They can call the consortium and do their paperwork right there if they're without a phone or only have a few minutes on their phone, those types of things. Which then at times we end up having somebody go out and kind of help them through the process if need be. Fortunately, some of the ARPA-funded positions have been invaluable in that situation, because they can come out and kind of sit with people and walk them through, because they are very difficult things to fill out, and it can be very daunting. So Claudia does a lot of that stuff and supports all of the staff in the different areas. So let's see. We pride ourselves in being able to help consumers right at the front. We tend to be the connection with the staff and that work in the community a ton with their clients. And so, I just want to thank you for the opportunity to inform you on what we do. We try and make things more efficient and more effective for all the staff and the consumers. I again want to reiterate that these staff are amazing. They deal with a lot every day, and it's different every day, so you never know what you're going to step into when you come in. We would love for you to come in if you want to come in and take a look. If you want to set up time with me, shoot me an email. I'd be more than happy to show you around the building. I know that some of you have been when you did the tour, but anytime I'd be happy to do that. So do you have any questions of me or what we do?
Any questions?
It's more of a comment, Colleen, than a question. And I don't even know where to start, to tell you the truth. You've got a great group of folks up in front. For as many different times as I come in up there, it's amazing to listen to how they handle some of the folks that are in there. You know, some are coming in just screaming left and right at them, and they're just calm. They get everybody calmed down. They do a super job with that one. Willing to help each other from one window to the next. If I need to get a hold of Bob, they kind of pass the buck on that one and say, well, it's your turn to call Bob, because Dave was here today. But they're good, and trying to get hold of staff, too. They do a great job serving our community and the folks that are in there that really need the help. And my thanks is off to them. You kind of puff your chest out a little bit as a county supervisor once in a while, too, because it's amazing the phone calls that I've had over the years. And somebody will say, you know, I was nervous walking in there, but those folks right away at the front window, they got me calmed down. They got me to who I needed to see, and they said, we can't thank them and the entire staff enough. So hats off to everybody. You guys done a great job. Thank you.
Yeah, thank you. No, I appreciate it. Yeah, one of the things that we are always, well, I guess I'm not so amazed anymore, but when people come in and be like, you really do that here too? Like, it's like I have to kind of say, yes, we take care of people from birth until death in this building. So it's the whole range of ages and everything in between. So, yeah, any other questions? All right, thank you.
Thank you.
Thank you, Mr. Chair. And then Tammy Wilson's going to provide an overview of the Records Division.
Hi, thank you for having me. I'm Tammy Wilson, the record supervisor. This is provided in your packet as well, this PowerPoint presentation. I'll start with our mission statement. The mission of the Records Division is to provide and maintain a high standard record that is an efficient, productive, and cost-effective information system which is conveniently accessible to appropriate and authorized service providers and meets all applicable and administrative, legal, and regulatory requirements governing the Department of Human Services. This is our division. We have currently 4 record technicians, and with our newest hire at the bottom, we'll start September 7th. What is a record? Most of you know what a medical record is, as if you've been to the doctor. The legal health record is the documentation of healthcare services provided to an individual during any aspect of healthcare delivery and any type of healthcare organization. The documentation that compromises the legal health record may physically exist in separate and multiple paper-based or electronic systems. And the legal health record serves to support the decision-making of the patient's care, support the revenue sought from third-party payers, document the services provided as legal testimony regarding the patient's illness or injury, response to treatment, and caregiver decisions, and serves as the organization's business and legal record. So what do? We provide administrative support to the internal staff, external providers as well. We assist with telephone and walk-in requests for records and information. We do transcription. We do filing. File maintenance is the creation of a record. So when we went live with our EHR in 2015, we have created 8,000 new medical records. Scanning and uploading, we've scanned over 28,000 documents in 2022 so far. We do a lot of auditing and chart review. Release of information, I have some stats on the other pages. retention and destruction based on county retention policies, and enter billing for emergency services and telehealth. Roughly, we have around 2,700 open clients. That's including child protection of 319. Here are the divisions that we support. The regulations that we follow under federal are HIPAA. 42 CFR Part 2 is for substance use, and of course Wisconsin statutes. We have transcription services for our docs. We have 2 psychiatrists and 1 psychologist. That number isn't correct. That was when I did the presentation in '21. So back then we had completed over 2,000 dictation jobs. Our turnaround time is typically within 2 days. And we have 2 certified medical transcriptionists within our division. When scribe is what we use, that's what the Sheriff's Department uses as well. Release of information. We have had roughly to date 684 records we have sent out. Background checks, 74. Children's services records to be released are around 76. Next slide. And then just a little bit of history. Our first, well, you can see the binder of the book, and then to the right of that, that brown Treacy and Company. Our first entry was March 10th, 1897. I have records going as far back as that, from the insane asylum when it was called that. And this is what we look like today. This, on the left, it was the 74 building, and then right now where we are today. I also help with onboarding and training of all the staff at Health and Human Services in compliance with HIPAA. Fraud, waste, and abuse training is due every year. We have confidentiality training, and we have privacy and securities under HIPAA training. We are also implementing our new addition to our EHR, our electronic health record, under the 21st Century Cures Act. Maybe Bob will talk a little bit about this. An example I can give you is when you go to the doctor and some of your results are given to you right away in the patient portal. This falls under that, where we are required to have certain documents accessible to our clientele. So we're working on our patient portal right now and determining what documents will be available to the clients for Health and Human Services. So that's the records division. Does anyone have any questions?
Any questions? Deb?
So I didn't see public health listed as a division you support. Is that not correct?
Not as much anymore. We have Roxanne that does mostly that.
Okay, okay, thanks.
Kathy?
I was going to ask the question about the CARES Act and the electronic records. And so is that patient portal is part of that situation? So how long is it going to take to implement that?
We should have that by the end of this year. We're working on it right now. We just weekly meetings with our NetSmart community, and so.
I can imagine it's a big undertaking.
It is.
Any other questions? Thank you.
Yes, thank you very much.
Okay, Bob. Next up.
Thank you, Mr. Chair. Thank you, Colleen and Tammy. Colleen's division, I think of as her area as the face of HHS. When people come there, those are often the first folks that they see, and it's important that, as Supervisor Osna said, when people come in distress and they're oftentimes not even sure what they need, and just walking in the door can take courage for them to come in. That it's important to have that element of calmness and a smile just to welcome people as they come in, to engage them at that point. And then with the records division, just quickly, I just wanted to mention the old book for the insane asylum, as it was known, is fascinating. And I was looking through it when I first started here, and I thought, well, that's incredible that this is what they used to diagnose people with. But all right, so thank you both for that orientation.
I just was going to say one.
Yes, sure.
One thing I forgot to mention, just because I want to just say that we also at the front truly appreciate the other staff from all the other divisions. So we do have a children's services intake, and we have the behavioral health intake, and they are so supportive and responsive to us at the front, and so we truly appreciate that, and they are definitely a support to us. So I just didn't want to forget about them, because it does make a huge difference if you're struggling and you're not exactly sure what they need or how to help them, that there's somebody else that you can pass it off to that you know is going to maybe have a little bit more knowledge and possibly a little bit more time, because that's the other issue at the front, is that the phone is still ringing or somebody else is coming in the front door when somebody's really needing some of your attention. So we truly appreciate those in the back that are doing the access for both behavioral health and children's services. So yeah.
All right, so if we move on to this summary at the very end of your packet, and use the same template that you've probably seen in other board meetings or possibly you've already seen. There was one correction, though, I'd want to point out before I get started on giving an overview of this. If you go down on the left-hand side, 1, 2, 3, 4, in the fifth item, it says inform Health and Human Services Board of financial condition. It says that it's not a mandated service, but I believe it is under Chapter 59.61 of statute. So we should make that correction to yes, it is a mandated service that we provide. We'll make that correction. But going back up to the top then, we tried to look at the various, as you can see from the headings of the different columns, we tried to break down the administration division into service areas or distinct kinds of areas of that would apply to financial and programmatic kinds of needs that the administration division oversees. So there's my position as the director that is required by statute, and the statute authority is listed there where it is a mandated service. And a brief description of what I and the department intend to do with the funding primarily being a tax levy for all the positions and support that we provide in administration. And the expenses there include, of course, salary and fringe for administrative staff and operating expenses for the support of the department. Also kind of connected with my position is the supervision of all the division administrators and oversight of all the divisions under HHS. It's under that next item. When I say in the comments section of that the administrators and I work together to try and find ways in which to integrate service delivery, where that becomes challenging sometimes is in the regulations that apply to each division or each program or each service that are not often compatible. So sometimes we have to be creative in how we, behind the scenes, look to integrate service areas so that they're more customer friendly, even though it might require more work behind the scenes to make those services happen. But all of the divisions are kind of abbreviated there under that item. Drafting of the budget, it's also a mandated service and a high priority. We're currently talking with Ken, the county administrator, and our fiscal manager, Leah Symington, to work through the HHS budget right now, so we're in the process of doing that. The next item was around grants and reimbursement from the state and federal, local sources. Just quickly with respect to grants, we would always look at grant opportunities that align with our mission, vision, our service areas, and would only apply for those that we think would enhance or somehow add value to the department as a whole. So when we do grants, we have to be mindful of the time it takes our staff to write them because we don't have a grant writer. So it's a time-intensive effort, and we want to make sure that when we do that kind of work, it's meaningful and has a prospect of adding to value, like I said, to the work that we do. Faye, the finance team that works at HHS, Faye and her team, are not under my supervision, but they are under our budget, and we work obviously very closely together as a team. But just that distinction that the direct supervision of the finance team is under Leah Symington, but the costs are under our budget. And stop me if you have questions. I'll look up every now and then. The preparation of board agendas, and primarily for me, that consists of the HHS board and working with Chair Telejohn on the HHS board agenda, but I also work with Kristen Newton and the board chair for the Council on Aging to help prepare those agendas. And I'm the chair of the CJCC Behavioral Health Committee, so prepare those agendas, and in partnership with Phil from Justice Support Services. The next item was around legislation and advocating for particular legislative items. We're in the process of doing that now, working with the state associations, the Wisconsin Counties Association and the Wisconsin County Human Service Association, who often bring forward our legislative priorities to the legislature and advocate and lobby on behalf of, I'll say advocate on behalf of county interests. So right now we're in the process of looking at budget papers, that is all the counties in the state are looking at budget papers and prioritizing where our local priorities are. When it gets a little closer to the next session, we'll be more involved in talking with legislators locally and promoting our interests around certain areas that we believe would benefit from either additional funding or changes to statute or changes to rules. So we get heavily involved in that. It's an interest of mine to do that. I did it in a previous job where I worked very closely with legislatures, and I think there's great benefit in doing that work. It's not a mandated area, but nevertheless, as you know, policy is a key feature of our success. So. And let's see, the contracting piece, we do a lot of contracts, purchase contracts with various providers in our community for CCS, behavioral health, children's services. Faye's team prepares and reviews those contracts with me to make sure that we're getting the kinds of the needs met by our community members that we can't provide directly. There's a lot of those contracts that come through, but all of which I think benefit our residents. Performance evaluations are also something that we all do as a way of making sure that we're in touch with our employees and understanding where their needs are and where they're doing well, and making sure that we evaluate them every year. Records, as Tammy mentioned, is a necessary component of the work we do for billing, to avoid any legal liabilities, and really just as you would expect for any kind of health service, you need to maintain records that are accurate and reflect the work that you did with that person and in order to bill all of the different payers that we have to be accountable to, that we show that our records are well kept. So that division is not mandated either, or that area is not mandated either, but it's a necessary component of what we do. And it's a high priority, of course. And then the office support team, as Colleen mentioned, all of the things that they do as a part of the public-facing aspect of their work, and also in the support they provide for all of the divisions and myself. So unless you have questions, I think that's kind of where I ended up with this.
Excuse me, any questions? We gotta have one.
I'll just say I think this format works pretty well, because then we understand what the programs are before you tell us this stuff. I think that worked well. I don't know how everybody else feels, but.
Yeah.
And this was my trial run at it, so as we get into the other divisions, it will become sometimes very complex. I'll try and make it as simple as I can on this format, but we have obviously divisions with multiple service areas that get complex, not just in terms of what they do, but how they're financed. I'll work with Faye and those division administrators as we go throughout the course of the next few months, and we'll try and make that as concise and clear as possible on this form. But of course, the division administrators will come with me in the event there are specific questions, and Faye will be here to answer specific questions that you might have as we get into more depth in some of those areas. Okay.
Thank you for all the information, and you know, you're getting done with budget, now we have to do all this. I guess that's it for business items. Requests for future agenda items. Is there any other requests for? Yes, Deb.
I was just wondering if we're going to have a communicable disease update from public health. I was kind of curious about monkeypox, if that's active in our county at all, if there's any issues with that. So I'd like to hear maybe from public health on that.
You'd like to hear a report on?
Just a communicable disease update from public health, if
Okay.
that could be on the agenda.
Any other future agenda items? No. The announcements or correspondence? We can't be out of here by 6. Oh. Good. We got to keep Adam here for longer. Nothing?
It's okay, I'll see him again tomorrow.
Yeah. Oh,
Do we have any new applicants on the MD side of the board, the committee?
Yeah, it's in process.
anything else? Hearing none, I'll adjourn the meeting at 5:43. Thank you, everyone, for showing up. Come again for another short meeting.